Welcome to Healthy Frontiers. My name is Dr. Bizzoni. I'm a chiropractor. This show is dedicated to the education of our viewers. The topic for tonight is dermatological issues for our feet. And my special guest is Dr. Bruce Pinker, a doctor of podiatric medicine here in White Plains. Dr. Pinker is a member of the American College of Foot and Ankle Surgeons and the American Board of Podiatric Surgery. He also belongs to the American Professional Wound Care Association. He is an active member of the New York State Podiatric Medical Association and the American Podiatric Medical Association. He's a former member of the New York City Marathon medical team. Dr. Pinker is a professional health and wellness speaker. He specializes in foot and ankle surgery, sports medicine, diabetic foot care, and wound care. Every fall, Dr. Pinker conducts his annual holiday shoe drive for the homeless and invites our viewers to participate in this worthy cause. So I'd like to welcome Dr. Pinker to our show.
Thanks for having me, Lou.
Oh, it's my pleasure, Bruce.
Thanks.
Bruce, we're going to talk about some dermatology thoughts today. So, nail fungus of the foot. Let's get right to it. It's very common. How many Americans suffer from it?
Well, the statistics actually show there's about 40 million Americans that suffer from nail fungus. So, and the medical term for nail fungus is onychomycosis. So for any of our viewers at home that are big Scrabble players, that's a great Scrabble word. They can win the whole game with that one word. Yeah, right. So with nail fungus, very common. Yes. It's about 20% of the U.S. population, right? And interestingly, we find that in the U.S. there are a lot of diabetic patients who also suffer from nail fungus. Mm-hmm. There are about 20 million diabetic patients that we know of. There are about 6 million not even diagnosed with diabetes, but diabetes suppresses the immune system. So there you have a higher chance of getting an infection, and nail fungus is actually an infection of the nail. Okay, it's a disease of the nail, and it's caused by an infection of the fungus. So there's a big crossover there with diabetic patients who have nail fungus, and it's a startling number, and it makes you really understand why there are so many different treatments for nail fungus, because so many people have it.
Sure. It's pretty common then. Okay, and how does someone know if they actually have a nail fungus versus some other condition of their foot?
Well, if someone has a discoloration of the nail, it could be white, could be yellow, could be brown, there could be streaking. It needs to be checked out appropriately. Okay, so what I always do is I perform what's called a nail biopsy, and it's not painful. It's very easy to do. It's not painful for the patient. It's just a simple clipping of the nail, basically.
Yes. That
That sample goes out to the lab. The pathologist reviews it and sends us a report. So with nail fungus, the biopsy, it's very routine, and that is actually the gold standard for knowing whether or not you have nail fungus. Okay, that's what needs to be done. If anyone is being treated for nail fungus with some type of antifungal medication, and they never had the nail biopsy done, or at least a sampling of the nail, it's incorrect. It needs to be tested, because some people actually have discolored nails that are not fungal. Could be yeast. If you use an antifungal medication to treat yeast, it will not work. Most of the time, it usually fails. And if it's just discolored for some reason, perhaps nutritional deficiency, they need to take some type of supplement, a nutritional supplement, and that's readily available. It's over the counter, and it works very well.
Yeah, okay.
Yeah.
So what are some of the treatment options? Now you've gone through, which I've always adhered to, get the proper diagnosis, then the treatment will follow, and there's hopefully the correct treatment in most cases.
Right.
Okay? But if you've now done your biopsy, done your testing, and now you definitely know what the problem is, then what are some of the treatment options for nail fungus?
Yeah, well, there are quite a few different options for your treatment when you have nail fungus. First, of course, get that diagnosis from the biopsy. Have it tested and looked at by the pathologist. You're positive for nail fungus. Okay, so you can treat it with laser. Laser is available now for this type of problem. It is usually not covered by any insurance. Okay, it can cost $500 to $2,000 for the treatment, so it can be expensive.
Right.
An expensive option, and it's not a permanent option, a permanent cure. You may have re-exposure to fungus in about a year or 2 years. So that's important to understand about the laser. Yes, it'll treat you. You'll get rid of the fungus right away.
Right.
If you're not willing to wait, you get a quick treatment. Right. but you could have re-exposure to it and it's not covered by insurance.
Okay.
Now, there's also topical treatments for nail fungus. Topical treatments, and there's also oral antifungals, okay, a pill you would take. The one that was popular for many years is Lamisil, okay. Lamisil was very popular because Novartis was promoting it. Many advertisements were made. The patent on that has expired. It's now a generic medication, not very expensive. It's about 80% effective on nail fungus in the best studies that were ever run. So that's not bad. But there are side effects to Lamisil that may cause problems with the liver, the kidneys, could lower your white blood cell count, which is very important. So there are some considerations. There was another oral medication for nail fungus called Sporanox. Not used that often anymore because there were many side effects with Sporanox. Okay, so you have oral medication. There's topical medication as well for nail fungus, and that seems to be more popular these days. I offer that option to all my patients actually, and most of them are choosing it. There's a topical medication. There's one called Formula 3. It's 95% effective against fungus, and it's very safe. You know, it's very safe. It's very effective. It's not very expensive. It's usually about $40 for a bottle that would last you for about 6 months, and the course of treatment is about 6 months for Formula 3 to treat nail fungus. Now, Lamisil took about a year to give results. Formula 3 will give you about 6 months to give you results. So it's half the time as Lamisil. It's much safer. It's very effective. The only problem with a topical is if someone should have an allergic reaction, and at this point, none of my patients have had a reaction. So it's really the best option there for most patients.
Well, you know, just a quick question before we move on to another type of dermatological problem. Does a patient usually have a symptom in their foot or the nail area? Is it going to be itchy? Is it going to be painful to bring them to your office to say, Doc, what's going on here? Is it just a discoloration?
Well, when we talk about nails, it's usually a discoloration, and sometimes the nail is very thick, and it could be difficult for the patient to cut it by himself. So that's what we usually see. Itchiness, not too often. We see more itchiness with athlete's foot, which spreads usually to the bottom of the foot or to in between the toes. And we're talking about, you know, in this area here, in between, right here, on the bottom of the foot as well, right here. That's what we typically find, athlete's foot. But with the nails, it's usually just that thickening and the discoloration. Will they always get the thickening of the nail, or is it just well, over time it does become thick. If it's caught very early on, no, it won't be very thick. But the problem with nail fungus, as well as athlete's foot, is that they're contagious. They can spread. So it may start in one toenail, but can spread to other nails and even to the foot and develop the athlete's foot that we commonly see.
I understand. So let's go on to athlete's foot then. Itchiness of the foot, and you know, what are some of the causes of an athlete's foot rather than the fungus of the nail?
Well, interestingly, athlete's foot, which we typically call tinea pedis, that's the medical term.
Another Scrabble word.
That's the diagnosis, tinea pedis, right? That's caused by the same types of fungus that cause nail fungus. Similar type of problem there. It's usually caused by T. rubrum and T. mentagrophytes. We shorten that because it's a very long word. Great Scrabble word again. Trichophyton rubrum and Trichophyton mentagrophytes typically cause both problems in the skin and in the nails. So, you know, with athlete's foot, you know, it's typically going to respond well to a topical type of medication. And there's quite a few. There are generic medications. They've been out for a long time. Something called Spectazole. Not expensive, usually responds well. Most athlete's foot will respond well to Spectazole. Twice a day it's used. Very simple. There are some other brand name antifungals for athlete's foot, such as Naftin and Loprox. But it's usually used twice a day for about 3 weeks. There's usually a resolution at that point.
Are some of these over-the-counter where someone can just walk in?
Well, the ones I just mentioned are by prescription. These are prescription only. What we find is the over-the-counter medications for athlete's foot do not work very well. If you've had it for at least a week or so, you're probably not going to respond to with the over-the-counter type of approach.
Right.
You know, but a similarity also with athlete's foot and nail fungus is that in some cases we actually may have to take a biopsy of the foot, of the skin, for athlete's foot, just like we would for the nail. First line treatment is usually a topical antifungal for athlete's foot. It's very commonly found. Looks like a what we classically call a moccasin type distribution, like that Indian type of footwear, a moccasin, right? So that it'll see scaling all around the foot in a specific type of pattern. So that's what we'll find typically. Topical usually works. If the foot is a little resistant to the topical treatment, yes, we take a small sample of the skin, not painful again, and send it out to the lab. Let the pathologist tell us exactly what is going on there at that point.
Right. Okay. And it's mostly between the toes and the bottom of the foot.
Yeah. Athlete's foot between the toes can be very painful because the skin can crack, it can burn, and the burning can be very exquisite. That's a very specific type of pain that nobody will ever forget. It's very uncomfortable at that point. You definitely need some type of treatment for that at that point. Usually a topical treatment will work very, very well. Sometimes it needs to be combined with even an antibiotic as well, because there can be a serious infection in between the toes at that point.
I understand. Okay. So I think we have a good understanding, and I hope the audience does, of itchy athlete's feet, and the initial one we spoke about. What about warts? Talk about warts.
That's
today.
another common problem that we see on the skin of the foot.
Yeah.
Warts, you know, we do commonly see it in children, but anyone can develop a wart. I've had adults with warts on their feet.
Right.
Older patients on Medicare, 65, 70 years old, present to the office, wart on the bottom of the heel.
Right.
Okay. So the wart actually starts from a virus. It's a little different from nail fungus and athlete's foot.
Right.
Those come from fungus. The wart comes from a virus. But what's interesting about all three of these areas, is that they begin with a foot that's inside a shoe, that's very warm, that's sweaty, that's dark. When it gets moist and dark inside the shoe, that's when the athlete's foot and the nail fungus like to grow, and that's what sometimes will develop. And in some cases, a wart will develop.
Sure.
And the difference is the wart comes from a virus. It's the papillomavirus. It gets into the skin. There are many, many different strains of the papillomavirus.
Right.
So this strain specifically is in the foot. Okay? And they can be very painful too, just like athlete's foot can become very painful, especially in between the toes.
Right.
So warts, very common. And again, we see it a lot in children because they play outside a lot. And they're in the sandbox, they're out in a soil-type environment, outdoors. They're more exposed to different pathogens. And that's where the virus is more likely to be, and it takes advantage of the situation, and that's where the wart starts to grow.
So it's more common in children or in
It
adults,
is
would
more
you say?
common, but adults can develop them just as easily. And what research has shown is that warts can develop because of stress, physiological stress. Warts can pop out and develop in different parts of the body.
Yeah. Okay.
Very interesting. And some warts will actually resolve spontaneously, which is very interesting too. I don't recommend anyone waiting for a wart to resolve on its own, because that may take a very long time. It's actually somewhat unusual for the wart to resolve on its own. So usually treatment's necessary because the wart is contagious, just like nail fungus and athlete's foot.
Versus, I guess the common term is a corn.
Right.
What's the difference between a corn and a wart?
Well,
if someone sees a growth on their foot, how do they know?
Well, again, the wart is caused by a virus, but from the appearance, they may look the same.
Yes.
I do see patients from time to time that think they just have a corn that hurts on the bottom of the foot, many times beneath the second metatarsal bone, right in here, beneath that joint, by the second toe. That's a pressure point. Usually, it is a corn. Occasionally, they have warts, or they may have a wart associated with it right next to it. So the difference in appearance is that a wart may actually have some small brown spots, tiny little like pinpoint brown spots within.
Right.
Okay, and a callus is typically yellowish or maybe a little brownish in color, yellow-brown. Okay, and it's thickened. The wart can be thickened too, so there is a lot of similarity there. Yeah,
Okay.
it's good that you asked me that, because there is a lot of similarity between a thick callus on the foot and a thick wart.
Yeah.
Okay, the
Sure.
treatment is very different. A callus needs to be removed. We need to, at some point, reduce the pressure on the callus in some way, and there are many, many ways to do that. Sometimes we use an orthotic like this to alleviate the pressure on a pressure point or a trigger point in the foot, but a wart needs to be treated medically in some way. So as far as, treating a wart, there are many, many different options. If anyone checks on the internet, searches for wart treatments, okay, especially plantar warts. On the foot, we call it a plantar wart because it's on the foot, plantar. There are many different options for treatment. So one option is also laser, as we mentioned. That is a little bit extreme, at least for my patient population. It's available, but it's a little extreme because it causes a wound that has to heal. Okay, so most patients don't want to change their lifestyle because they have a wart. So a smarter option is to reduce the wart slowly by shaving it down and applying a little medicine to it. It's usually not painful at all. And little by little, after several treatments, the wart will resolve. And that way, the patient doesn't have to change his or her habits, her lifestyle.
Right. Makes
Pretty
a lot of
much,
sense.
you continue on. It's a series of treatments, though. There are, interestingly, some treatments for warts that are done by mouth. Medication can be taken by mouth. Not my first line of treatment, but we do offer it for patients with the resistant type of warts.
Right.
They can take Tagamet, which we find over the counter now for antacid. Right. The medical name, the scientific name is cimetidine. Okay, that's available. It has to be dosed accordingly for the patient, but that can be taken. It's been proven to treat warts. There are several other ways to treat warts. Even duct tape has been shown, not proven, but has been shown to treat warts in some way.
Duct tape?
Yeah, to resolve a wart. We find that it cuts off the oxygen supply. Duct tape is very strong. It's a solid sheet, and it will reduce the oxygen supply to the wart, and that way the wart will die off. The warts actually have a strong blood supply. They're vascular, as we say. They have strong blood supply, and it's not easy to reduce a wart without some type of treatment, some type of intervention. But usually shaving it down very carefully and applying a little medication to it to reduce it slowly is the best approach.
Right. Great.
Yeah.
All three of these conditions we've just spoken about are very similar. I want to just talk about what we can do to prevent it: warts, athlete's foot, and fungus infections. So, how can you avoid these conditions?
Well, any patient of mine that is diagnosed with a wart, I put them on some type of powder treatment. They're on some type of regimen using powder. And the best powder we find, from my experience, is using Ziazor with a big Z. It's available in just about every pharmacy over the counter.
Okay.
It's very easy to find. It's not very expensive. Twice a day, they usually apply it either to their feet or into their socks, and that will absorb some of the moisture that's been building up, and this will speed up the healing process and help the wart to resolve faster.
Right. Great. What are some of the best types of socks that we can wear? Between kids and running and really sweaty socks, and what are the best socks?
Well, socks are very important, very important.
Yeah.
And powder is important too with socks. And one thing I'll add is my patients with athlete's foot and even nail fungus are told to use the powder as well for their cases as well, because it all comes back to a sweaty foot. So some of them I will, if necessary, because they're not using the proper socks already, we'll discuss the proper socks that they should be wearing. And the best socks are actually a blend of 65% cotton and 35% polyester. There's a lot of room for variation in there. We can't always find that perfect combination, but that's what we've found through research is the best. So the all cotton sock that we may have used in gym class back in high school, not good anymore. Okay, it holds too much moisture in it. It keeps the foot too wet. And when the foot gets wet, we develop these problems that we're talking about here today. So socks are very important because not only will they cushion you and support you in many different ways, there are socks that are made for running, for golf, for hiking, very specific. They'll cushion you in many different ways, give you the support you need. But aside from that, we need a sock that keeps the foot healthy. okay, and relatively dry. And of course, you never want the foot to be dried out, but relatively dry. So that's important. So what we're talking about is the new technology also that's been built into socks, such as copper and silver that's been added that help the patients to heal. Patients who suffer from diabetes, from wounds that are not healing properly, from poor circulation.
Right.
These qualities we found will help in socks. We've actually incorporated silver into many different medications and wound care products over the years, and we find copper helps as well, especially when it's incorporated into socks. So socks are very important.
Can be gotten over the counter? You know, these types of socks, I mean, you can buy them anywhere?
You may have to go to a specialty store
Like a
for
running
them.
store or
yeah,
something?
there are some doctors that will dispense these special socks from their office. They may not be so
Right.
easy to find for everyone. You may have to go to a special store. They could be purchased online, I believe, in most cases. But socks are very important, you know, and a lot of people go without socks,
Right.
and they're running a risk by not wearing the proper support and maintaining the right environment. And you deal with the Yankees.
Yeah.
You know, you're working with the Yankees. And there's a special athletic sock that's being used by New Balance and a few other companies that's 91% polyester. You may say that doesn't sound so comfortable to me.
Right.
Well, it tends to be pretty comfortable. I've actually worn that sock,
Yes.
okay? And that will help dry out the foot properly, especially for those high-profile athletes that are very active. They need to keep the foot healthy. If a player on the team had a bad case of athlete's foot,
Yes.
right? If Jeter gets athlete's foot, we don't know if he's going to hit his 3,000th hit, but I'm pretty sure he will eventually. But if he gets a bad case of athlete's foot, he could be sitting on the bench for another couple of games until it resolves. It may take a week to finally clear up. And it's a little embarrassing just because the right sock maybe wasn't worn or the foot wasn't dry enough.
Right.
So socks, very, very important.
Awesome. Okay, great. You know, we're coming around summertime. Actually, yesterday, first day of summer. So, and people be wearing sandals a lot. How do sandals affect the skin? You know, as far as...
Well, sandals are important too because we wear them in the warm weather. Everybody's wearing sandals when it gets warm out.
Yes.
Just about everybody is.
Yeah.
So a sandal needs to support you in the right way. And the worst type of sandal, so our viewers take something home here that's really important to know, is the flip-flop is bad. The flip-flop is the worst sandal because it does not support the foot. Okay, the heel flips and flops. That's where we get the name. It flips and flops off the actual piece of footwear,
Yes.
and it causes a lot of irritation to the heel. We'll look on the model here. We see the heel back here all gets irritated, very thick, callous skin. It can crack. When it cracks, it can be dangerous. There could be an infection that's setting in if the skin becomes cracked. Okay, usually it's not being worn in a clean environment, right? It could be on the beach, in the sand. Sand can become wedged into the cracks in the heel, and there could be a problem there. There could be a very serious problem there. So the flip-flop is not recommended. The sandal has to hold the foot right. There should be a strap around the ankle, and the rest of the foot should be held securely to the piece of footwear. And of course, there should be good arch support. You know? It's important. A lot of people get very poor support from sandals, and they suffer from a lot of foot pain because of that.
Sure, you can see that. How about not wearing shoes around the house all the time? You know, question comes often, is it better to not wear a shoe during the summertime running around the house, or is it best to have something?
Yeah, well, I know what you're saying there. A lot of people, they want to go without shoes. It's so warm out, and they're comfortable without the shoes. Letting the foot breathe is not a bad idea, but in the house, you need to be careful that you're not going to step on something dangerous to the foot.
Right.
Okay, whether it's a sewing needle, a child's toy, right? You want your feet to be protected. Even a simple slipper is a good idea, is important to wear in the house. Summertime, wintertime, your feet should have some protection because sometimes we don't really know what's on the floor around us.
Right.
Yeah.
And the support part of that, if someone's needs because they have a bad arch, is it best to wear it 24/7, pretty much, an arch support, or is it better to give it a break and in the house wear nothing for a while, and then just when you go out put a shoe on that has a good arch support or an orthotic or so?
Well, our feet are made to be functional.
Yes.
So if we're in the house, we're simply standing, we're not doing much walking, or we're sitting around in the house.
Yeah.
We're still functioning by standing, right?
Mm-hmm.
We're using our feet, so there should be some support at that point. But if we're doing a lot of walking, we go out to work for the day, we go to the gym, we go running, we definitely need the support at that point.
Right.
So everyone is an individual case
Sure.
for that, when they need the most support. When they're most active is when they need the most support. And in the house, no, I don't see my patients wearing their orthotics inside their slippers. I don't think anyone has that extreme of a case. But if they are going to be very functional in the house, walking, doing a lot of walking, it would be recommended to wear the orthotics in a pair of slippers in the house, depending upon the level of activity.
Awesome.
Yeah, absolutely.
Good answer.
Yeah.
What's good for heavy calloused or dry feet?
Well, what I find works best for dry feet, heavy calluses, such as the one people might get at the beach this summer when they're in their flip-flops, which they shouldn't wear anyway,
Right.
but the heels get dried out. There's a product called Carousel, which works very well. It's over the counter. It's just as good as anything by prescription. And the Carousel will exfoliate as well as moisturize the skin. Now, my instructions for my patients are to soak the feet first in that dry area, scrub down with a pumice stone, and then apply the Carousel. There are some other more advanced steps for those that have resistant type of cases, but usually that works very well, and it's readily available in most pharmacies over the counter.
Terrific.
Yeah.
So, Dr. Pinker,
Yeah.
why don't you give the audience a last take-home message before we close now?
Sure. Well, the big take-home message is that you need to understand that your feet are your foundation for your body, right? So taking good care of your feet are very important, and for some of us, it could be the first step towards good health. This is something I put in my newsletter every month that I send out by email. So take good care of your feet, because they will bring you a long way down the road. You need to watch out for nail fungus, warts, athlete's foot, and to prevent that, again, keep the feet healthy and relatively dry. Not dried out, but relatively dry, using some type of powder like the Zeazorb powder, and wearing even some type of footwear that allows the foot to breathe. There is a brand of footwear called Geox. Very good. It allows the foot to breathe. There are micropores in the sole of the shoe.
Yes.
So that's a great way to keep the foot nice and healthy, allows the foot to breathe. And that way we avoid all these common problems that many of us have. Over 40 million people have nail fungus. So
Right.
if we can cut that number in half, that would be a dramatic step forwards.
We're definitely hitting a home run then.
Yeah.
Dr. Pinker, thank you so much for being on the show.
Thanks for
It's
having
great
me.
having you.
Yeah.
If you have any questions for Dr. Pinker, please go onto his email, and he will be happy to answer them. Look forward to seeing you on the next show. Good night.